Hi everyone, my name is Maura Van Bogart and I will be talking about toxoplasmosis. So the causative agent of toxoplasmosis is Toxoplasma gondii or T. gondii, and it's a single-celled protozoan obligate intracellular parasite, and it infects approximately 1/3 of the world's population. The intermediate hosts are virtually all warm-blooded animals, but the definitive hosts are members of the family Felidae, most notably the domestic cat. So Toxoplasma gondii is considered to be one of the most successful parasites since it can virtually infect any warm-blooded animal to serve as its intermediate host. And the prevalence rates are significantly influenced by dietary habits and behavior, and they can range from 10 to 80% in specific populations. So there's a high prevalence of infection in France because of their preference for eating raw or undercooked meat, whereas there's a high prevalence in Central America because of the large amount of stray cats in a climate that favors the survival of oocysts. And the CDC reported more than 40 million people in the US are infected with T. gondii. And since most people infected are asymptomatic, there's so many people living with T. gondii that don't know it, which is kind of scary. So there are three main modes of transmission, and that's foodborne, zoonotic, or congenital. And it can't be passed person to person besides mother to child. And in some very rare instances, it can be passed from organ transplants or blood transfusions. So there are two broad components to the life cycle, and the first is the sexual component, which occurs only within cats, and that makes cats as the definitive host, and the asexual component, which can occur within virtually all warm-blooded animals, including humans, and these are the intermediate hosts because only asexual reproduction can occur. So now we're going to kind of go through like the whole process of this parasite. And so sexual reproduction in the feline as the definitive host. So a feline is infected with T. gondii by consuming an infected animal carrying the parasite's tissue cysts. So the parasite infects the epithelial cells of the cat's small intestine. And once inside these intestinal cells, the parasites will undergo sexual development and reproduction that produce millions of thick-walled zygote-containing cysts known as oocysts. So infected epithelial cells will then rupture and they release the oocysts into the intestinal lumen, where they are shed in cat's feces. And oocysts can then spread to soil, water, food, or anything potentially contaminated with the feces. And these oocysts are highly resilient, and they can survive and remain infected for many months in both dry and cold climates. So the initial infection of the intermediate host, so this is humans or warm-blooded animals, when an oocyst or tissue cyst is ingested by a human or animal, the cyst wall is dissolved by proteolytic enzymes in the stomach and small intestine, and this frees the sporocytes from within the oocyst. And the parasites will first invade cells in and surrounding the intestinal epithelium, and then they differentiate into tachyzoites, which is a different cellular stage of the parasite. And the tachyzoites are the more motile and quickly multiplying stage. And these tachyzoites can enter the lymphatic or bloodstream, and that allows them to reach any organ or tissue in the body. And these tissue cysts can form about 7 to 10 days after the initial infection. So inside the host cells, the tachyzoites replicate inside these specialized vacuoles, parasitiferous vacuoles, and these are created from the host cell membranes during the invasion into the cell. And these tachyzoites will multiply inside the vacuole until the host cell dies and ruptures, which then releases and spreads the tachyzoites via the bloodstream to other organs and tissues of the body, including the brain. And in this image at the bottom, on the bottom right, these are 4 developing tachyzoids and this white area around it. That's the parasitiferous vacuole. So following the initial period of infection is the proliferation of tachyzoids throughout the body. And the pressure from the host's immune system causes T. gondii tachyzoids to convert into bradyzoids. And bradyzoids are the semi-dormant, slowly dividing cellular stage of T. gondii. And so inside the host cells, these clusters of bradyzoids are known as tissue cysts. And these tissue cysts can form in any organ. But they predominantly form and persist in the brain, the eyes, and the striated muscle. And having these tissue cysts is the chronic infection stage. So consumption of tissue cysts in meat is one of the primary means of T. gondii infection for humans as well as other meat-eating warm-blooded animals. So risk factors for human infection include consuming raw or undercooked meat, poultry, and seafood containing T. gondii tissue cysts, ingesting water, soil, vegetables, or anything contaminated with oocysts shed in the feces of an infected animal. And cat fecal matter is particularly dangerous because just one cyst consumed by a cat can result in thousands of oocysts. And this is why it's recommended that pregnant or ill people don't clean out a cat's litter box. Blood transfusions or organ transplants are possible ways to get the infection, but they're less common. Congenital transmission, as well as drinking unpasteurized milk. So toxoplasmosis in immunocompetent individuals is usually asymptomatic or very mild infection. That's why most people who are infected don't know that they're infected. So in 80 to 90% of cases, there's no clinical symptoms in the acute infection. But in some cases, there is cervical lymphadenopathy and just flu-like symptoms. So toxoplasmosis in the immunocompromised is a little more serious. So the host immune system plays a key role in the control of the parasite replication and maintaining the tissue cysts. But reactivation of latent infection or chronic phases of infection can occur more often in the immunocompromised patients. And this can be like HIV or people going through immunosuppressive therapies or chemotherapies. And HIV patients in particular, toxoplasmosis is the leading cause of central nervous system lesions in AIDS patients and the development of life-threatening toxoplasmic encephalitis or TE. And this can be seen in the 4 images up here. This is a toxoplasmosis in a 28-year-old man with HIV. And this shows the necrotic appearing mass lesions in the bilateral basal ganglia. And these are just the bradyzoids that are contained in the tissue cyst. And down here, you can see in the images of the brain scan, all of like the lesions and the edema from the toxoplasmosis infection. And at advanced stages, it can also be cause pneumonia as well as encephalitis, which obviously will result in death. Congenital toxoplasmosis is another severe form. If a mother acquires the infection before becoming pregnant, the unborn baby is protected by the mother's immunity. However, if the mother is first infected during the pregnancy or just before, the degree of severity is inversely related to what trimester she is in that she acquires the infection. So infection of the fetus during the first trimester often leads to miscarriage, stillbirth, or a child born with severe abnormalities of the brain and eyes, such as hydrocephalus, intracranial calcifications, seizures, retinochoroiditis, deafness, blindness, really grim things. Here you can see this is the hydrocephalus, and within the brain are the calcium intracerebral calcifications, and this is a chorioretinitis. So if the mother contracts the infection in the second or third trimester, it's less likely to cause severe clinical manifestations in the child, but it may result in subclinical disease that later in life can lead to retinochoroiditis or learning difficulties. So the immune response, just briefly, the tryptophan is an essential amino acid for us as well as T. gondii, which it scavenges from host cells. And so interferon gamma induces the activation of indole amine 2,3 dioxygenase, or IDO, and tryptophan 2,3 dioxygenase, TDO. And these two enzymes are responsible for the degradation of tryptophan. And so the pressure of the immune system eventually leads to the parasite forming these cysts, normally deposited in the muscle and in the brain of hosts. Now, the interferon gamma-mediated activation of IDO and TDO is an evolutionary mechanism that serves to starve the parasite, but it also leads to depletion of tryptophan in the brain of the host. And so because of this, there's increased levels of kynureninic acid in the brains, seen especially in infected mice. And this increased level of KYNA in the brain is commonly seen in individuals with schizophrenia. And also the low levels of tryptophan and serotonin in the brain are associated with depression and other psychiatric disorders. So T. gondii, in healthy individuals, chronic toxoplasmosis is generally regarded as clinically asymptomatic. However, an increasing number of associations are being made between various medical conditions and T. gondii infection. So in humans, there's an increasing body of literature that indicates that chronic toxoplasmosis is associated with abnormal host behavior, and it influences the progression of psych disorders such as schizophrenia, depression, and OCD. And in a study of 285 participants, revealed that depressed individuals who attempted suicide exhibited higher T. gondii antibody rates than those who did not. And in elderly women, age 60 or above, are more prone to suicidal attempts when they're seropositive for T. gondii. And in recent studies, it's been found that T. gondii is 3 times more prevalent in schizophrenic patients. And the mechanism for the T. gondii causing the psychosis isn't known, but it's assumed that the presence of the cysts in the brain may affect the concentrations of dopamine, nitric oxide, or the formation of antibodies against globulins. There are also many instances of behavioral changes that have been reported in rodents with T. gondii. And so infected mice or rats, there's a reduction in their innate dislike of cats, making it easier for the cats to prey on the rodents. And additionally, there's seen is worse motor skill performance in infected rodents as well. In human studies, they found that infected men are more likely to disregard rules and were more expedient, suspicious, and jealous, whereas infected women were more warm-hearted, outgoing, conscientious, and moralistic. So if it's to test for T. gondii, the diagnosis typically is made by serological testing, and it measures the immunoglobulin G and immunoglobulin M. So there's no vaccine, and there's also no cure for toxoplasmosis. Once you have it, the drugs can control symptoms, but they don't eliminate the parasite from your body in those tissue cysts. So generally, a combination of drugs, permethamine and sulfadiazine, in addition to folinic acid, is generally the course of treatment, and it can be used with pregnant women as well. And for immunocompromised individuals, the same medications are used, but it could be for a lifetime. That's it. Thank you.